Katherine Johnson from Learn Behavioral, back with another video for parents. Today we're talking about desensitization. Desensitization is a process of taking a stimulus that's aversive to someone and slowly exposing it to them over time, so it eventually becomes less aversive. You can do this with things that are simply non-preferred, things that are an actual phobia, and then everything in between. The first thing that I want to say about using desensitization is that it exposes your child to something that's non-preferred, maybe uncomfortable, or even anxiety-provoking. So before you use desensitization, like anytime you're choosing a goal, you need to examine it carefully and weigh the costs and benefits. So if being able to tolerate this aversive stimulus is something that's functional or will improve the quality of their life or has to do with health and safety, and then that benefit outweighs the cost of the discomfort of going through desensitization plan, then maybe it's something to try, and you can discuss it with your behavior analyst. I'm just going to give you a couple of examples of when it may be appropriate or not. So I had a client one time who was extremely afraid of roller coasters and other amusement park rides. She had a family that loved Six Flags, but she didn't enjoy it. She didn't enjoy the physical sensation. She didn't want to do it. So would it be possible to do a desensitization program and get her to stop hating roller coasters and being afraid of all the other rides? Maybe, but it also would have exposed her to something scary and uncomfortable that would not have really improved her life at all. So I didn't think it was an appropriate target. On the other hand, I've had multiple clients who really disliked when people looked in their mouths or the noses associated with the dentist's office and just overall having a dental exam. That is something that's actually really important for long-term health. So even though the desensitization process will not be fun for them, it's in their best interest and their long-term health and comfort. So that would be a more appropriate skill to use desensitization for, assuming that dental health was a high priority within the grand scheme of what that person needed to work on. The most common things that I've used desensitization for are accepting non-preferred foods, tolerating medical procedures, becoming accustomed to common noises like vacuums or telephones, or any type of phobia of a common object. So with all of these things, the process is roughly the same. The first thing you do is relaxation. You want to teach your child relaxation procedures and coping skills. The second part is the progressive exposure. That is allowing your child to experience the aversive stimulus, at first just briefly, and then incrementally more and more over time. So let's start by talking about the relaxation procedure. You can teach deep breathing exercises, you can teach progressive muscle relaxation, or other mindfulness exercises like counting, if that's in the repertoire. You want to get your child to be really proficient with whatever coping skill you decide to teach, because you're going to use these to help them relax just before you expose them to the target stimulus. And then you can also cue them to use these skills during the exposure. Next is the progressive exposure. Exactly how you do this will depend on the aversive stimulus that you're working with, how aversive it is, and also how effective your relaxation procedures are. I'm going to walk you through a couple of examples of how you would use these, but remember that it's really key that your child's progression is individualized to them specifically, and your behavior analyst can help you with that. The first example I'm going to walk you through is a desensitization program for eating food. This is also called graduated exposure. The first thing that you would do is to put together a hierarchy of ways to interact with the food. That would start with the easiest thing, like maybe just having the food on a plate and a table in front of you without knocking it off or gagging. And then that might be followed by like touching the food, picking it up, smelling it, touching it to their lip, licking it, all the way to the point where they're taking normal size bite, chewing it, and swallowing it. So once you've laid out that hierarchy of expectations with the food, you're ready to start your session. It's always a good idea to offer choices. I hope you've seen our choice making video. So you can start by offering several different target foods to see which food they want to work on first, which can help with their motivation. And then you have them do their relaxation exercises. After that, you can begin with the steps of the hierarchy. So for instance, if you were working on tomato, so you have a bite of tomato on the table in front of them, or whatever your first step of the hierarchy is. They tolerate it, you praise them, deliver a reinforcer. Then, maybe depending on their level of anxiety around the food, you might do a relaxation procedure after each step, or maybe you just do it at the beginning, whatever works best for your child. So the next step is that then they touch it. So you model touching it, and then when they touch it, you praise and deliver a reinforcer. So you continue to go through all of the steps of increasing difficulty, and you're delivering reinforcement the entire time. And at some point, if they're unwilling to go on, you might go back to some of those easier steps so that they can be successful before you end the session. Or you might just backtrack a little bit to an easier step and then try to gain some momentum to go past that earlier sticking point. So for instance, if they're not able to take a bite, go back to just picking it up, reinforce that, just touch it to their lip, reinforce that, and then continue on to see if you can kind of get the momentum to get them past that sticking point. Desensitization takes a longish amount of time, but it's certainly one way that you can treat food selectivity. The next example that I'm going to walk you through is getting kiddos to tolerate dentist visits. So you would start by making a task analysis, like an outline of what they need to do, what they would experience, feel, hear, see, go through, sitting in the waiting room, having someone identified as a dentist come in and get them, have them sit in a dental chair, maybe like lean back in the chair, get a bib on, and then experience the sounds that they'd hear in a dentist's office. So like suctioning sounds and drill sounds. And then doing the things that the dentist might ask them to do. So like opening their mouth, keeping their mouth open, having tools put in their mouth. So basically the desensitization program that you might do is to start with the relaxation and then do a role play. So they would do all of the steps that they would experience in the dentist's office, and at the same time, they've got someone next to them to help prompt them through and to praise each step and reinforce. So you get as far as you can through the role play, stop when they're ready to stop, and then the next session you do the whole thing over again. So the point of this is that they're experiencing this repeatedly in manageable chunks with someone there to help them use relaxation techniques throughout, provide reinforcement, and over time it becomes less aversive, and then they're able to go to the actual dentist. One of the ways that we're using desensitization a lot these days is teaching kids to tolerate wearing a mask. So a mask wearing desensitization program would again begin with getting your child proficient at a relaxation procedure, and then beginning the hierarchy with maybe just touching a mask, praise and reinforce, then touching the mask to their face, praise and reinforce, holding the mask across their nose and mouth. This is the point at which the relaxation procedure becomes really important, because that can be really anxiety provoking for some children to have their mouth and nose covered. Praise and reinforce, and then eventually leading up to them being able to actually put the mask on with the straps and tolerate it being on for a second or two, and then incrementally increasing the amount of time that they're able to wear the mask. One more thing that I want to say before I go, doing a desensitization program can be tricky. So I highly recommend that you work with a BCBA to determine, first of all, if it's an appropriate technique to use, and second, to help you outline how to use it. Thank you everyone for tuning into this video, and I will see you next time.